if you have diabetes, we know that you have increased risk for heart disease, but you don't have to have a heart attack.
So coronary heart disease, at its essence, is a situation where there are blockages in the blood vessels that supply blood flow to the heart. And diabetes is a condition where blood glucose levels are elevated. In an environment with high blood sugars or high blood glucose, there's damage to those blood vessels, and those blood vessels can't supply blood to the heart in an effective manner. And that's how they're linked, and that's why diabetes makes heart disease worse.
One of the challenges of taking care of patients with diabetes and evaluating their heart is oftentimes they don't have symptoms of heart disease. And about 35% of the time in diabetics, we find that they've had a heart attack by just looking at their EKG, meaning the heart attack happened sometime before that visit.
And heart disease does run in my family. My father had it, and I actually had a heart attack back in 2001. But at that point, nobody was saying the two were connected.
So all diabetics should have some degree of cardiovascular screening. That may just be an EKG that's done in the office. That may be a stress test if it's indicated. All diabetics should have their blood pressure measured every time they go to see the doctor.
So people with diabetes should be paying attention to how they feel when they're active, when they're physically active. They may feel winded, they may have pain in the chest, they may have tingling in the arm. So, people with diabetes don't perceive pain the same way that other people do. So it might come on as something that they think is heartburn, or they just don't feel right in their chest.
Well, in diabetic patients, there are similarities in the cocktail of medicines that we give them that we do in people with heart disease or at high risk for heart disease without diabetes. And that would be aspirin to prevent blood clots and blood pressure medicines, particularly of the blood pressure groups ACE inhibitors or angiotensin receptor blockers. In diabetic patients, they're very important in terms of preventing kidney disease.
In patients who have diabetes, if you're over the age of 40, because you're considered at such high cardiovascular risk, regardless of what your cholesterol level is, you should be on a cholesterol-lowering medication.
I'd just like to remind people with diabetes that it's never too early to raise the concern with your physician. So if you're having symptoms, you're not sure of what they are, don't minimize them, and get the attention that you need.